I, Dhananjay Sinha, on behalf of Adven Biotech and my sales team, welcome you all to witness the rising of a new star. Around 2 decades before, the assumption was homeopathy is restricted only to city levels. But now this legacy has been carried not only to city levels, to districts levels, and even to taluka levels as well as micro interiors. Among us, I have one doctor who has been specialized in treating skin cases with homeopathic medicines, purely with homeopathic medicines. With big round of applause, I wish to welcome Dr. Pramod Yattinamani from Gokak to present his case. He wanted to present some.
Good evening. Let us start with the presentation. So, the story. First, we'll start with the story. Some motivational story.
The most traumatizing moment in Ruling's life was the day her mother died. She was 25 at the time. The death of her mother shattered her completely. This happened 6 months after she began writing Harry Potter, and she was sorry that her mother never knew that she was writing it. After the death of her mother, she moved to Portugal in 1992 and got married. Soon she gave birth to a daughter, Jessica. But things became worse. Sadly, her marriage didn't last long, and only after 13 months she divorced him and moved to Edinburgh with her daughter in the first 3 chapters of Harry Potter. She was forced to rely on state benefits and spent much of her time writing Harry Potter in cafes, with Jessica sleeping in the bar next to her. An exceptionally short-lived marriage had imploded, and I was jobless, a lone parent, and as poor as possible to be in modern Britain without being homeless. By every usual standard, I was the biggest failure I knew. Ruling fell into a deep depression and admits she even considered suicide. So, how her life changed then? Because she was so poor she couldn't afford a computer or even the cost of photocopying the 90,000 word novel, so she manually typed each version to send to publishers. After sending her manuscript to 12 different publishers and getting rejected by every single one, Roland began losing confidence in her book. Finally, the publishing house in London, Bloomsbury, a small London publisher, gave it a second chance after the CME's 18-year-old daughter fell in love with it. Her books have since sold more than 450 million copies, won innumerable awards, been made into movies, and completely transformed Rowling's life. In 2011, Forbes estimated Rowling to be worth about $1 billion. She remains on its list of the world's most powerful celebrities and top-earning authors. J.K. Rowling went from being a jobless single mother to one of the best-selling authors of all time. But it didn't happen overnight. She faced rejections and constantly strived for success. She worked hard at her craft before anyone noticed her. If you have a dream or a passion and you just keep getting rejected or run into failure, don't let that stop you. If you're going through a tough time in your life and working on something you really believe in, don't give up. Who knows, you might end up breaking records. So, what's your story?
Thank you. Let us start with the presentation. Good evening. Myself, Dr. Pramod Yattinamani, practicing in Gokak, Balgam district. So let us share with my experience in dermatology, homeopathy for skin. This presentation entirely based on my clinical experience from the cases in everyday practice. So single specialty practice, is it possible with the homeopathy? Yes or no? The answer is yes. So, young homeopaths future as a homeopathy or other system of medicine. So, of course, we have graduated homeopathy. So, come to the scope of homeopaths in dermatology. There is a huge scope in dermatology as there is an increase in the level of skin diseases today. Almost everyone come across a situation where they have rash or an illness which needs medical attention. Now is when dermatologists have more demand than ever before. Homeopathy in dermatology. Because of the recurring expenditure and side effect of the existing methods, it is less expensive, no recurring expenditure, without any side effects. We have scope in the following areas: hair fall, alopecia, dandruff, tinea, vitiligo, warts, acne, keloid, psoriasis, chloasma, etc. In nail, brittle nail, deformed nail, discoloration of nails. Other than that, cosmetic allergy and complexion. So, dermatology, why did I choose to present on this subject? So, as many of you know, treating skin conditions or disorders can be challenging. I believe they are significantly more difficult to treat without aid of homeopathy. For many years now in my practice, I have focused on and researched the homeopathic treatment of skin conditions and have gathered numerous before and after pictures of various skin diseases among my own patients. I recently felt to share my findings with my colleagues in hopes that they will benefit from this information. What is dermatology? Dermatology is a branch of medicine dealing with the skin. It is specialty with both medical and surgical aspects. A dermatologist is a specialist medical doctor who manages diseases related to skin, hair, nails, and some cosmetic problems. Common skin diseases in everyday practice. So, fungal infection, acne vulgaris, alopecia areata, psoriasis, vitiligo, urticaria, scars, chickenpox, hair fall, chloasma or melasma, boils, corns, warts, impetigo, keloids, lichen planus, dandruff, skin tights, etc. Some skin conditions. acne vulgaris. So let me tell you about the acne is also known as acne vulgaris. It is an inflammatory disorder of pilosebaceous follicles which is usually occurs in adolescents of both sexes. It is a very common skin disorders which can present with inflammatory and non-inflammatory lesions. It is primarily affects skin with a relatively high number of organs, including the face, upper part of the chest and back. The resulting appearance can lead to lack of confidence, anxiety, reduced self-esteem, and in extreme cases, depression or thoughts of suicide. In 2015, acne affected approximately 633 million people globally, making it the 8th most common disease worldwide. Acne commonly occurs in adolescence and affect an estimated 80 to 90% of teenagers in the Western world. Children and adults may also be affected before and after puberty. Although acne becomes less common in adulthood, it persists in nearly half of affected people into their 20s and 30s, and a smaller group continues to have difficulties in their 40s. So, one more skin disease is fungal infection. So, fungal infection is also known as mycosis. It's a disease caused by fungi. Different types are traditionally divided according to the part of the body affected. Fungal infections have a worldwide distribution and are common, affecting more than 1 billion people every year. So, differential diagnosis, some tinea and candidiasis infections of the skin can appear similar to eczema and lichen planus. Pityriasis versicolor look like seborrheic dermatitis, pityriasis rosea, pityriasis alba can look like vitiligo. What's are non-cancerous viral growths usually occurring on the hands and feet, but can also affect other locations such as genitals or face. One or many warts may appear. They are distinguished from cancerous tumors as they are caused by a viral infection such as human papillomavirus rather than a cancerous growth. Warts are very common, with most people being infected at some point in their lives. The estimated current rate of non-genital warts among the general population is 1 to 13%. They are more common among young people. The estimated rate of genital warts in sexually active women was 12%. Warts have been described at least as far back as 400 BC by Hippocrates. So, a range of types of warts have been identified, varying in shape and site affected, as well as the type of human papillomavirus involved. These include common wart, a raised wart with a roughened surface, most common on hands but can grow anywhere on the body, sometimes known as a palmar wart or junior wart. Second one is flat wart, verruca plana, a small smooth flattened wart, flesh colored, which can occur in large numbers, most common on the face, neck, hands, wrist and knees. Filiform wart, a thread or finger-like wart, most common on the face, especially near the eyelids and lips. Genital warts, verruca acuminata, a wart that occurs on the genitalia. Periinguinal wart, a cauliflower white-like clusters of warts that occurs around the nails. Plantar warts, verruca plantaris, a hard, sometimes painful lump, often with the multiple black specks in the center, usually only found on pressure points on the soles of the feet. Diagnosis. On dermatoscopic examination, warts will commonly have finger-like or knob-like extensions. So, chalassma or melasma. It is also a very common condition in females. So, melasma, also known as chalassma, is a tan or dark skin discoloration. Melasma is thought to be caused by sun exposure, genetic predisposition, hormonal changes, and skin irritation. Although it can affect anyone, it is particularly common in women. Signs and symptoms. The symptoms of the melasma are dark, irregular, well demarcated, hyperpigmented macules to patches. These patches often develop gradually over time. Melasma does not cause any symptoms beyond the cosmetic discoloration. Patches can vary in size from 0.5 cm to larger than 10 cm depending on the person. Its locations can be categorized as centrofacial, malar, or mandibular. The most common is centrofacial, in which patches appears on the cheeks, nose, upper lip, forehead, and chin. So, differential diagnosis, melasma should be differentiated from freckles, solar lentigo, toxic melanoderma. Also, cases of drug-induced pigmentation have been reported. So, this is the vitiligo. So, this is corn. This is the keloids, alopecia areata. So, come to the homeopathic point of view. Homeopathic case taking of skin disorders, a thorough history and physical examination is necessary. Characteristics of the appearance of the skin condition, color, discharges, and consistency. Example, pimples and red rashes, etc. So, discharge. What color is the discharge? Very important. Example, yellow, thick, honey-like discharges, etc. Sensation. What does it feel like? Itching, pricking, burning, etc. Modalities. What makes it better or worse? How do the following affect the skin? Washing, bathing, heat of the bed, time of the day, season, weather. Location, hand, feet, scalp, folds of the joints, etc. Concomitant, things that are associated with the skin problem. Example, mental, like anxiety, or upset, or generals like words, exercise, etc. Allopathic drugs are extremely suppressive and can make the skin look better than it truly is. You need to take this into consideration during case taking. So, discharges are very important, finding the remedy. The various characteristics of the discharge can definitely help lead to the correct remedy. Example, bloody, clear, honey-like. Some helpful rubrication, skin eruption, discharging, honey-like, graphitis. Skin eruption, discharging, sketching after graphitis, ligages, lycopodium, dust, skin eruption, discharging, bloody. Entium crudum, calcareaca, carcinosin, crotulosauridis, ligages, marxol, naxomica. Skin eruptions, dry, bleeding, scratching after alumina, arsenic, calcarea, lycopodium, petroleum sulfur. So, remedy selection. Come up with a list of several good possible remedies. You can go with what you know yourself off the top of your head. Second, use therapeutic books and come up with a few top remedies that match your case. If still not successful, then reprise. This takes time, but it is the best way. Find the primary rubric to narrow down your choices to help you figure out which remedy is the best. Always ask what should I focus on first. Decide on what is ailing the patient. Does the nervousness or fear of the skin condition? Think of fearful remedies. Or is the smell of the skin is unique, or is the sensation of the skin severely disturbing the patient, as in the severe aging of mesothelium? Or is the etiology unique, as injury induced bruises seen in the arnica? These are the some rubrics: skin, acne, allergies. So, skin, vitiligo, skin eruptions, crusty itching, psoriasis, itching, moles, warts. So, these are rubrics. So, homeopathic medicines useful in dermatology. So, abrotinum, angioma phase becomes purplish from eruptions, agaricus. So, ammonium carb, anacardium. So, anthracinum boils, carbuncles, abscess, terrible burning pains, arsenic album, acid, arantrophalicum, badiga, raggeds, freckles, skin sore to touch, belladonna, barberries acufolium, scalp erection, extending to face, neck, pimples, dry skin, psoriasis. Calendula promotes granulation and prevents suppuration, erysipelas. Cantharis, carboanimalase, carbolic acid, Bovista, urticaria, Buforana, blisters on the palms and soles. Every slight injury separates bullet leaf, raw surface with aqueous fluid. Caladium, Asafoetida, Astacus, Basilinum, ringworm, eczema of eyelids, glands of the neck enlarged and tender. Eugenia jambosa, Euphorbinum, graphitis, Dolichus, Nalcamara, Echinacea, Corallium, Crotontic, Condoranga, Castoriquae, Causticum, Crassabinum, Carbon malis, carbolic acid, carcinosin, Caladium, Calendula, Cantharis, Syzygium, Thuja, Urticaria, urticaria with violent itching, rheumatism, alternating with urticaria, complaints from suppressed urticaria, burns and skulls, angioneuritic edema. So, Verulinum, Vinca minora, X-ray, Staphysagria, Streptococci, sulfur, sepia, silicea, socumchuk, dry eczema, urticaria, antisoric medicine as per the body. Sanicula, Sericinia, sickle core, pyroxenum, small injuries become swollen and inflamed, septic condition. Rustox, Rus veneta, petroleum, sorinum, pulsatilla, madorinum, itching at night. When thinking of it, fiery red rash about anus in babies. Mercurius, Azerium, Calibrum, Malandrium, Mancilla, Hypericum, Ichorium, Ignatia, Meristica, Natramur, nitric acid. So these are the some homeopathic remedies helpful in the condition of the skin disorders. So let us see some before and after pictures. So this is the case of acne. So date and everything it is mentioned on that card. So you can see how many months treatment has taken. So infants, so burns, pimples, scarring, plantar, so chickenpox, alopecia areata, so dryness of the skin, lips, plantar, fungal infection. Thank you.
Belgaum. This is the place from where I started my homeopathic marketing career. At the age of 24, as a medical representative, and Belgaum is the place which has molded me to become a good medical MR. Belgaum again is one of the places in Karnataka where we have 4 homeopathic medical institutions imparting quality education to thousands of students. I am privileged from my beginning of career to meet eminent doctors like Uchankar sir, Vernekar sir, Jowli sir, Kuntigi sir, Konkani sir, who have always motivated me to present anything in the best possible way. I learned many things. What is the difference between allopathy, homeopathy, only from these senior doctors. Today I have a professor, head of the department of physiology from Bhartesh Homeopathic Medical College. I welcome with loads of applause Dr. Yogesh Dravid to come and present his case.
Good evening, sirs. I thank Adven Biotech Company for giving me a chance to present my acute cases. I just want to present in brief about how fast is homeopathic result in acute emergencies or in acute presentation at our daily general practice. So I am going to just give a short highlight over role of homeopathy in acute cases. So to begin with a short case, This is a case of a 19-year-old female staying at Yeldu Road, Vadgaon, and the case was seen last year during December, on 9th December. Just a brief explanation prior to this case. The onset to this child began when the cold wind started blowing all over the Belgaum. After there was a short thunderstorm and lightning episodes accompanied by short duration scanty rainfall in night. And then this patient, Miss ABC, presented with cold, coryza, running nose since morning. She complained of frequent episodes of sneezing with thin watery discharges which were hot and burning. The modality for this was, the sneezing was comfortable when in open air, or else it was intensified as she stayed in her room. She had less thirst. On the grounds of this little information, a simple remedy what I have learned in Materia Medica in first BHMS itself, Allium cepa, was prescribed in a single dose, and she was benefited by the remedy in the same evening. So following points were considered for selection of the remedy. The first point, nose coryza acrid, nose coryza open air amelioration, nose coryza aggravation in warm room, discharge is thin, sneezing air amelioration, nose sneezing coryza with, sneezing warm room aggravation, thirstless and weather cold wet aggravation. So these were the points considered, and we analyzed the case, and Allium cepa was the selected remedy. The other remedies which come parallelly along with Allium cepa are Naxomica, which has stuffed nose at night, stuffy colds, snuffles after exposure to dry cold atmosphere, worse in warm room. Here coryza is fluent in daytime, stuffness alternates with nostrils obstruction and acrid discharge. It's mentioned in Boric. Pulsatilla, coryza with stoppage of right nostril, pressing pain at the root of the nose, with loss of smell, large green fetid scales in the nose, stoppage in the evening, yellow mucus abundant in the morning, and soreness of the nasal bone. Reference Boric. Other similar remedies like Aurum trifilinum, dull camera also play a vital role in acute emergencies during such cold weather changes. Another remedy, Sabadilla, which has spasmodic sneezing with running nose, coryza with severe frontal pains and redness of eyes with lacrimation. It also has copious watery nasal discharge. Second case. This is a case of an acute headache which was seen as an acute emergency. The patient was an employee of Syndicate Bank, and it was March end, and because of stress over the work, he had to bear lots of efforts, and it was hard working time for them. Very less time to have food and sleep at proper. So I received a call from one of our bank employee working in Maruti Galli at 7 p.m. I usually welcome the patients and greet them, and when the patient entered into my consulting room, I just saw that he is looking very bored, dull and nervous. As he was my family friend, I casually asked him, "What happened, sir? What's wrong with you and why are you so nervous?" The patient said, "Doctor, I got severe fever in the afternoon around 4:30 and I am feeling a bit drowsy and feeling as if I should leave everything and go to sleep." I just asked for any associated complaints. He said, "Yes, I do have headache with mental irritation, but I am troubled because of this heavy traffic. I am highly irritated due to the horn. Everyone is in a hurry to cross over bridge, but nobody wants to maintain the ethics of traffic rules. Traffic is not in our hands, so I can't avoid this." I just asked him, "Sir, what could be the probable cause of your fever? Because 2 days before I had seen you coming with your wife and you are absolutely fine." Patient said, "What to tell you, sir? This is March ending and our managers are really harassing us, I will tell you. I have lots of workload and even I am working from home. while driving to office, I have to receive many calls from the regional office and the chartered accountants regarding annual closure, and I am not getting any time for my own self-relaxation. I have recently shifted my home and not yet settled, and I have to work in office on Sundays also. I am just working like a donkey, traveling from home to bank and bank to home, and this is my hectic schedule. The patient said, I have severe heaviness in the body and I wish I should sleep quietly. Give me some medicine to sleep so that I'll go home, close my room, I can have a good sleep and can get up early in the morning and go back to the bank. Patient said, see doctor, let me tell you frankly, if I don't go to bank tomorrow, again I will have to listen to the shoutings of manager. First of all, the staff is less and the workload is also more. So I am humbly requesting you, please make me healthy by tomorrow so that I don't want to listen to him back. I am thirstless, I don't have any desire to drink water, I just want that I should lie down and sleep. This was the case. This was the casual conversation, yet we had not examined the patient. Then I examined the patient for his temperature. It was somewhere around 102.7, well marked. Pulse 100 per minute, BP 130 by 80 mm of Hg. Now I could not ignore this patient for fever. So based on what history he gave, I just selected 4 points. Ailments from busy work being desires to be quiet, aversion to be disturbed and thirstlessness. I arrived at the remedy Bryonia alba. After noting the points, a dose of Bryonia 200 was administered to the patient immediately in the clinic and 2 more doses were given for emergency if required to be taken, so that if the patient again gets acute episodes, he may take it. After reaching home, he checked around 10 pm, the temperature was reduced and he had a sound sleep and got up at his routine time and went back to the bank. After 2 days, he came back for follow-up saying he did not take the second dose and third dose as the same night he had profuse sweating and body pain and fever had also come down subsequently, which did not reappear till now at least. So this was my approach in treating acute emergencies or acute complaints. As a general practitioner, I just treated these cases with single remedy and single dose. Thank you, sir. Thank you.
Being working for a pharmaceutical industry, I sell tons of supplements, tons of specialties, that is the combinations. But when it comes to personal level, I go to my doctor, whole of my family, take treatment with him, and we personally at home have experienced the miraculous results of single remedy. And Dr. Uchenka's student, Dr. Morgan, TP Morgan, he is my family doctor rather. So I have a number of examples which I can quote, but maybe it's not the what you call the no way related with my presentation of today's. But now I would like to request Dr. Uchenka sir, Konkani sir, Vendekar sir, please speak few words. Whatever you felt about Adven Biotech, at least about the presentation of Adven Biotech, what did you feel about the new factory, ultra modern? Yeah.
Medical career. See, what has happened is we are making one mistake. What I feel, homeopathy is a complete science. Treating all type of cases is our duty, and homeopathic medicine is effective. Everybody's experience is nothing new. Everybody should have the confidence. What two speakers have shown the confidence, and you have to come forward and tell the cases. Let it be acute case or chronic case. Every case is important. Every case you treat with a dedication, you will have a result. There is nothing called as no results in homeopathy, provided you take an overconfidence, whether it is a palliative disease, whether it is a curative disease, that you identify and tell that I have cured the case or I have treated the case. Nothing wrong in palliating the case if the case is palliative disease. What you have learned for 4.5 years plus 1 year training, or PGs we have additional 3 years of teaching, learning. This is an experience which you are trying to put up with a lot of innovations in your practice. Second point, giving to regards to the Adven laboratory, wherein they have brought really a revolution in the manufacturing technology as well as the homeopathic products compared to other companies, as it is said that it is NABL accreditation. Wherein this is a required moment to understand. One should try to remember, everybody should join hands for criticism which is going on towards homeopathy, because homeopathy is recognized or identified by WHO, telling that it is the second largest system of medicine accepted in the world in the science. There are so many factors behind criticizing us, is marketing industry, the drug industry, the mafias, or different type of pharmaceutical industries, because if homeopathy comes to the first level, there is a lot of loss for those people. These are all working indirectly. For that reason, even though you are practicing different system of medicines for the purpose of treating the patient, there is definitely, it hurts for the homeopath, but it is also required thing. We cannot treat everything with homeopathy. It's a logical science. See, there are different type of practitioners which are practicing, an homeopathic practitioner, Ayurvedic practitioner, allopathic practitioner, naturopathic practitioner, unregistered practitioner, also hobby practitioner, or even you say the spa is also a practitioner now. So these are different type of practitioners which are having variation. What ultimately require you is, the raw material should be good and quality oriented. The drugs are manufactured as per the pharmacopoeia so that the quality is maintained, and the method of manufacturing is also equally important. That is, these are all the qualities which you observe. Ultimately the results depending, they are in the hand of the practitioner. So how he selects the medicine, how he selects the potency, repeats, and further these things are there. There is nothing wrong treating with a single remedy without repeating, or repeating with multiple cycle of remedies. Sometimes the combinations are used. We disagree at some level of combinations because they are not proved completely. They are all by therapeutic effects have been combined and given without understanding the correlation to each of the remedy. So the practitioner who uses, it is his will and wish. We are not coming to the disagreeable point. So with this, I feel all the learning people who are gathered here, they are well to understand. Everybody is a practitioner, everybody is a successful practitioner, everybody are going to face the defeat or the success at one or the other moment, but you should take it positively, try to improve. So with this, once again, I thank the Adven Laboratories for giving me opportunity to interact with you. Thank you.
Thank you very much, sir. Thank you very much. Uchalkar sir, Kongdi sir, Girish Kulkarni sir.
Good evening, my dear friends. It gives me immense pleasure to be amongst you this evening. At the outset, let me compliment you when you used to visit me as Yamaya of Maxis, and I'm really delighted and proud of you. Thank you for having raised this position, and the amount of effort that you people are putting in the manufacturing units is amazing. The quality control and other things. Of course, NABL demands everything in that SOPs and other areas. But I am really delighted to be a witness to this presentation. I wish Adven and you personally a very good luck. Let us hope. Thank you very much. That this manufacturing unit comes up to the best standards that are expected by the entire world and fraternity of homeopathy practical. Thank you for wishes, sir. And I am really delighted to see those two guys, Pramod and Yogesh. I'm really proud of you. And Pramod must have received shoutings by me in his college life, but I'm really proud of you, my dear. I always have been focusing one area, that all homeopaths today need to address one thing. Today's world wants evidence-based, number one. Number two, it is as Vivekananda said, I can treat everything is a folly. What I suggest is, like Pramod Yattinamani focusing on dermatology, I suggest all the younger generation homeopaths should focus on one area. Focus on one area. I still remember that Dr. Prabhakar Shetty from Mumbai focused on diabetic foot, and he created an amazing miracle in treating diabetic foot. He was being consulted by many diabetologists and surgeons for treating those cases. And what were the remedies used? Remedies are not surprising. You know, I still remember that sentence written in S. Das of, if you diagnose a rare disease, you are rarely correct. Cultivate a habit of diagnosing common disease, you are commonly correct. The same thing holds true here. It's not rare remedies. It's not, there are people who are the rare remedies, blah, 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 and that people in front will say that this is the first time I am hearing this remedy. That's not the case. The case is very clear that all these remedies fit into only those logical areas. And when I was witness to his presentation in one of the conferences where we shared the dice, at that time I asked Prabhakar Shetty, what are the remedies? He said, lacusis, arsenical, carbobage, pulsatilla, and sickle cord. Apart from this, I don't give anything. But we do give these things, but where somewhere something is lacking, and that's the area where we need to focus. What I suggest to the younger generation is focus on one area. It may be anything for that matter. You take only dermatology, you take only rheumatology, you take only IBS, you take only migraines, you take only those areas. Focus on one area, establish yourself. People should look for Pramod Yattinamani whenever a case of psoriasis comes. That should be the stage. People should wait for certain conditions wherever you have developed your own expertise. And that is what is the necessity of today. We as homeopaths, we always say that we can do everything. No. We have our own limitations. We always bear one thing in mind. Medical practitioners or physician or a surgeon for that matter should be able to understand what is not to be done and when it is not to be done, rather than knowing what is to be done and when it is to be done. More important is what is not to be done. Now, in certain areas, wherever your clinical document is lacking, please refresh that. What is required to be a homeopath is you must be a compassionate human being and a competent clinician so that you can differentiate things. You are able to come to a nosological diagnosis as well. And at the same time, you should be an ardent believer in the cardinal principles put forth by Samuel. With this, let me compliment the Adven laboratory. I would have really missed if I had not attended this so that I could have met my old friends. Thank you very much.
Thank you very much, sir. Thank you very much.
Good evening to everyone. Good evening, Dr. Uchakar sir, Kukri sir, Veronica sir, and Jodi sir. Sir, as Dhananjay sir has told, 15 days back only he sent a message to me that you have to come to Belgaum. Actually, I did tell him that I am staying in Belgaum every Saturday and Sunday. Thank you. And whatever the products from Adven are there, I am using since last 4 to 5 years. And those products are very good. And I am not hesitating to tell that in my practice I am using most of the biochemical remedies and combination remedies where they are giving me good results or think that it will be a valuable results. So coming to now, as I was saying, so many doctors are here where my patients are coming to them like Dr. Yogesh sir, Dr. Kadgir madam and Dr. I forgot his name, Kakne sir, and one more is there, where the patients are coming from Sankesha and all are treating in a good manner. When they come and tell me that, sir, we are going to the homeopaths of Belgaum, where they are treating very good and giving us medicine, so you also start giving here only. And I tell them, those are homeopaths, so you go to them only and take medicine from them only, so that you will be cured. And I am very much thankful to the Dhananjay sir for calling me and giving this opportunity. Thank you, Mandy. Thank you.
Thank you very much, sir. Thank you very much.
Do not give a mic to two people. One is to teacher and second is to a politician. Unless they make their message across the table, they won't leave the mic. I am really proud of Pramod. I am really proud of Yogesh. And I see Smita Kangralkar earlier. And I remember them. I am so proud, delighted to see my students flourishing in their practice. And you mentioned the name of T.P. Murugan, right? T.P. Murugan. Murugan was my student, and this amazing, and it's such a proud thing. But I would like to see my all students coming up like this with these presentations. I would like to be an audience. I would like to be an audience and sit and listen to you so that you make me feel proud and tall. Thank you very much.
To thank my teacher, Dr. Chandra sir, and even company sir also. Thank you very much, sir. Appreciated my presentation. It is continuously. Go on throughout my life, only for the knowledge. So your blessing is always after us, sir, and we are moving towards that, better towards homeopathy. Thank you, sir. Thank you, sir.
Thank all of you. You have honored my request. You came here, though Belgaum, I have been here since 4 days and I have experienced the rain throughout the day. For few minutes stops, again for inviting the doctors along with my executive. I have drenched, I got right, drenched, got right, went to the doctors for inviting them and thankful.
As a tradition in your company, every year, annually in Belgaum, involve the practitioners and practitioners so that they can share and reach to all the homeopathic colleges in Maharashtra and Karnataka and neighboring states so that the pharmacy students visit your unit and they will come to know the way the medicines are manufactured and the quality is maintained, so that confidence building from the first year the students we will have that confidence need to be given to the students, and such get-togethers are really required. And I suggest to you, whenever you promote your company, it is like Girish said, take some feedback from the practitioners who are using your product, put them, and so that propagation and your confidence building in your company also.
Definitely, sir, definitely. Thank you very much, company, sir. And this is the purpose. See, this micro CME. I have been organizing mega CME in metro cities like Bangalore and all, where a crowd of 150-200 people gather. But there, I cannot have this type of one-to-one interaction. That was the purpose. We designed micro CMEs where we are inviting 25 to 30 doctors. We explain them about it, and the purpose of calling the principals for this event was the same. As Dr. Kompany has said, I wanted the head of the institute to visit this program, and shortly, very soon, in every medical colleges will be having this kind of event, and they will be inviting all the freshers, all the interns, all the pages. plus the professors, teaching staff. So we'll be having an event one by one. We have already done this in Government Homeopathic Medical College. The response was good. And believe me, see, if the diagnosis is correct and selection of the remedy is correct, company doesn't matter. Whichever company's dilution you give, they will be this. This is what Sir Arjun sir. With Murugan sir, I have experience. Because the trend is for some red caps or bottles, dilutions, when it comes to dilutions. But Murugan sir in his clinic, if I as a representative am going, that particular point of time, whichever dilution is exhausted, he will order to me. If a Bahola recluse, he will order to him. If any trying to buy person, he orders to me. He is not very any specific about a particular brand. Then once I asked him a question, sir, you have been seeing dilutions of all other companies, but many of the maximum of the doctors throughout the country, there are only 2 brands. That is what they prefer. He said, if my selection of the remedy is right, medicine doesn't make any difference. This is what was the message conveyed by Dr. Murugan sir. Dr. Smita, Dr. Prajakta, Dr. Karuna, any message you want to convey? So, thank you very much for making this ceremony. Kiran Patil sir, please.
First of all, very thank you to Adven Biotech for inviting here, and with due respect to all my teachers and the senior people over here and the practitioners, congratulate to the presenters who the presentation, Dr. Ravi, Dr. Raj. Now what we see here, that this particular company, Adven, we don't know the company. We know the representatives. The representative who represents the company, when he represents in such a beautiful way, in a friendly way, I remember Mr. Dhananjay talking to us, sir, we are very proud to see you as practicing homeopathy immediately, and he used to say that we are selling these products. But what we see, the interaction what I had with him, doctor, we practice only single medicine. We are giving single medicines. We are not practicing this combinations. Your products what you are giving. But one or two experiences which I had with this Adven is in one of the baby where I had suggested external application, and actually I was not knowing which was a better one. So I had just called Padma Pharmacy. I discussed with Arun and I said that Adven's all-purpose cream is good one for babies. You please keep it. I was not aware of that. So I just gave it. I gave the baby. The baby was well with that. I just wanted to give some external soothing cream. Don't want to give anything else. The mother was insisting that she should give it. But after 2 years, the mother came to me and she said, Doctor, along with the baby, even I am using this cream for all time, and all my family members are using this cream. Where I had not prescribed it, I just suggested this. So I feel that this is the quality of these products which we see, the quality which is expected, which goes to the prescription. Without a prescription, has made a place in the family of the people who are using it. This is one thing. Second thing which I want to know is that for quality products, we were looking towards the other companies for the quality dose, or especially the dropper system, which we were influenced with in the initial phase of our practice, and that was the reason why we were with that. And we used to say that yes, this is a quality product. But now, as we see that being in India, we are talking of India, and this being an Indian company, a proud Indian company, I wish all the best and all the success to the company. Thank you.
Thank you, Dr. Kiran. Thank you very much for the motivational message you have conveyed to us. And we will definitely work on ourselves, develop more, and very soon, later or sooner, maybe in a couple of years, 1 or 2 years, we will be in the top 3 slot. This is the assurance, this is our dedication. We say in Hindi, no, there is a dialogue. खुदी को कर बुलंद इतना कि हर तकदीर से पहले खुदा बंदे से खुद पूछे बता तेरी रज़ा क्या है. The entire Adven field staff is working on this. As I said, later or sooner, in couple of years, we will be reaching where we want to go, and with the support of each and every one of you. And once again, I convey each and every drop of my mother tincture, each and every drop of my dilution, each and every tablet of my biochemic situations 1x tablets will give you the same result, same efficacy what you have been experiencing from existing brand, not only from the existing brand, but even as I confirm to international brands. I seek your blessings and cooperation. Thanks for coming. Let's continue this journey in a phased manner as Dr. Pomkini has suggested. I will start with the college events, then probably after a year or so we can have a mega CME in Bengal where we invite all the whole crowd of Bengal, whole BHMS doctors of Bengal. It was a we have identified around 30-40 doctors and we have called them. Unfortunately, some due to, they already had conveyed me that they will not be in a position to come because of some prior commitments. So anyway, thank you, sir.
I got one suggestion. Recently, I spoke with one of the pharmaceutical in Belgium. I asked them, what about the Adven product? They are not sure about the quality. Maybe a marketing strategy. So I think you need to explain how the manufacturing is done, how the quality is. This is one of the points I think so. They said, no, Adven product did not give you the satisfactory answer. Luckily, you came to me and you attended, we could verify. So that may be the message we also required to get a confident of the company products. They may be spreading a wrong message. So this may be the policy you have to convince them regarding the quality of the products. Because the marketing strategy will depend upon the different products, showcasing them, then the rates and prices and all these things may be attractive. So I think this is also equal.
Sure, sure.